back, everybody. Sorry we ran a little over, but we can do the meeting of the Harrow Valley Healthcare District Corporation. Those who need to,
Ready for roll call?
roll call, please. Thank
All
you.
right. Director Negus?
Here.
Director Cox? Here. Director Gallagher?
Here.
Director Simmons?
Here.
And Chair Friel? Chair Friel?
Yes, here. Thank you very much. I have an announcement to read, which is an amendment attendance. Dr. Gallagher has requested permission to attend remotely for Assembly Bill 2449, which states that a board member may participate remotely for a just cause should he or she have a contagious illness that will keep him or her from attending. I would like to make a motion that Dr. Gallagher be able to attend this meeting remotely. So need a second, thank you. Any discussion? Hold the board.
Director Negus?
Aye.
Director Cox? Yes. Director Simmons?
Yes.
Chair Friel?
Yes.
And Director Gallagher?
Yes.
In addition, a reminder, as you know, these meetings are publicly broadcast by way of Zoom. Even in the case that the public is not physically present, please consider that participants may be virtual and that the meeting is recorded and posted for public viewing. Moving on to closed session report. There's nothing to report from the results of the closed meeting. Any agenda modification considerations? The board. None? Move on. So there's a point in the agenda later on where there's public comment, board member comment. But I would like to welcome Stephen Gray as a Chief Executive Officer at his first meeting. He's been with us for 3 weeks now.
4 weeks today.
4 weeks today?
Yeah.
Welcome.
Thank you.
Very happy that you're here to come forward with me. So public comment on matters not on the agenda. Are there any people online, Rosalie, that are asking to
We
speak?
have one hand up. Saba, I will allow them to speak.
Thank you so much, members of the board. I'm joining you via Zoom because I'm at a vaping forum in Santa Cruz for our parent community, and I apologize I can't be there in person. It's really an honor to be able to speak with you and also to welcome CEO Stephen Gray. I think he's going to do an outstanding job as a CEO of the community hospital. I work as a county superintendent of schools, and I'm here as an educator, as a parent, and a longtime Watsonville community member to urge your support for the resolution before you to send the Watsonville Hospital bond measure to voters. As you know, our community came together with the support of our legislative delegation to prevent the closure of the hospital. And now that the hospital is under community control, we need to ensure it is on a path to stability and success. This hospital is in need of, as you well know, of major infrastructure improvements and to continue to provide quality service to residents that our residents deserve. This bond measure is going to enable our hospital to finally fully belong to the community and provide the resources it needs to expand and modernize its facilities and improve its emergency care. Watsonville Hospital is a foundational institution of so much importance for the Pajaro Valley. I urge your support for this resolution and for this essential investment in our community's health. Thank you for all that you do. Thank you for what you have done to continue to bring these needed services to our community. And please know that you count on my support to make sure that this bond is successful. Thank you.
Thank you for joining us. Thank you for your comments. Thank you for your support.
We have another hand up for another attendee online. Lisa, I will allow them to speak.
Well, before we continue that, it's just been called to my attention that, we're taking these public comments now, which is fine, but it's also on the agenda for our next meeting with the district.
Would we like to present the items in their entirety for this meeting so everyone knows what we are speaking to?
I'm thinking I didn't.
Should we list the items on the agenda for this regular meeting for the hospital corporation so the public knows what the items we would be speaking to? So would you like to do that or would you like me to?
Go ahead and do it.
On the Colorado Valley Healthcare District Hospital Corporation regular meeting agenda, we have minute approval from our October 25th meeting. We have policies and policy summary approval for November. We have the medical executive committee's report for November. We have the Watsonville Community Hospital policy report for November. We have the chief executive officer report and the co-tenancy agreement between Pajaro Valley Healthcare District and the Pajaro Valley Healthcare District Hospital Corporation. Those items are on this current meeting. We will have another meeting after with additional topics.
Okay, so we want to continue with public comment then.
Yes, I believe the hand has been taken down. We have no more
Okay,
hands.
so why don't we open the public comment for people who are present? Welcome.
I'm Jennifer Gavin, Director of Pharmacy and Respiratory Therapy. So last meeting, I believe, I presented some information about a program that the hospital as a whole is taking part in, and we call it Holiday Hope. It's collaboration with Centers for Vulnerable Families. So I wanted to give you an update. We had a bake sale, coffee bake sale and nachos today that raised $2,500. There was a $1,000 match. So if we came up with $1,000, which we did, we would get an additional $1,000. So that means today we raised $3,500. So, and there's a lot of you that I'm looking at that have contributed. Thank you very much. So what that means for our total is we're right under $8,900. So I haven't sent the update yet, Dr. Gabriel Cox, but so that is, and we got one gift card. So we're at about 180 kids and we're still pushing. We have a Santa, December the 9th, that will send out some information in the next week. Now that this event is over, but the community and the community and the hospital community in the whole has contributed greatly. So thank you guys very much for your support and help. And yay! So I need more names from you. Thank you.
Thanks, Jeff.
Good evening. My name is Becky Steinbrunner. I live in the Santa Cruz Mountains. I want to point out to you, it's relevant perhaps to something later in the agenda regarding the resolution for the bond. But Scotts Valley Fire recently lost their bid to get voters to approve a bond measure with a similar structure that you are going to be considering later. In today's Santa Cruz Sentinel, one of those voters who voted against the proposition but supports the fire station stated that had it been structured differently, rather to have everybody assess the same amount, they would have voted for that proposition. So I want you to think about that in your work tonight. Second of all, because I do attend Santa Cruz County LAFCO meetings regularly, I'm aware that Santa Cruz County LAFCO is pretty much in the dark about what is happening here. I do have a map that they were given, and those commissioners had many questions about the map of the boundaries of this healthcare district. So I would urge you to reach out as soon as possible to Santa Cruz County LAFCO Director Joe Sereno, and he's really waiting for the business plan. The third and lastly, I just want to make you and anyone listening, the audience, aware that Lions Club International is here to support anyone and everyone who cannot afford vision screening, eyeglasses, and eye surgeries, as well as hearing issues. They have a mobile testing van that will come to the hospital if you want, and we can set up. Right now, we have a December 9th screening in San Jose working with the Mexican consulate, and we would love to do something like that here in Watsonville. So please contact the local Lions clubs, and we're here to serve. Thank you very much.
Thank you, Becky. So should we contact a local Watsonville club or countywide club or?
Yes, the Freedom Lions Club.
Freedom Lions.
Yes, and then they will connect with all of the other clubs in the district that stretches from San Jose down to King City. Thank you.
My sister's the president of the Freedom Lions Club, so.
To be in touch.
My name is Chris O'Grady. I'm a family physician and a geriatrician. I've been in solo independent practice in Watsonville for the last 18 years. And prior to that, I was at Dominican Hospital. I speak strongly in favor of the bond measure. Those of us who have worked at Watsonville Hospital have generally accepted that for the past 20 years of outside ownership, there was a general neglect of the infrastructure, and things were patched when they had to be patched, but nothing that needed to be updated was getting updated, and that was just accepted. So I'll give you an example. The phone system is obsolete. If a doctor is on call and has patients on 4 floors, and they get a phone call that goes to voicemail because they're busy, they can't tell what floor that call is coming from, and I'm told that's tied to this obsolete phone system. So they have to call all the floors to find out who's trying to get a hold of them for patient care. That's really just a sample of lots of things that everybody sees. You know, the MRI scanner goes down frequently, the CAT scanner goes down frequently. 2 of the 4 elevators haven't worked in 2 weeks. The hospital really needs a lot of infrastructure upgrades, and that's one basis for the bond. I think for the bigger picture, I've always felt that the financial problems at Watsonville were largely tied to the fact that many of the patients with insurance in the hospital district have been systematically moving their healthcare to North County over the last several decades. And there's all kinds of reasons for that, but there's really an opportunity to bring those patients back to Watsonville Hospital, which would help the hospital, immensely. But to do that, you have to make the hospital more attractive, and part of that is physical, but there really needs to be service lines. There's a paucity of physicians. We need more specialists, and we need more primary care doctors in South County. Kaiser has helped, but it's not enough to overcome the shift of all these patients in South County who've been going to North County for their healthcare for the last several decades. So I think it would really.
Hi, Dr. O'Grady.
I'm sorry. Hi. So for the long term, I'm hoping that Watsonville could, by getting those patients back, and it will require improving the hospital in many ways and recruiting physicians. And to do that, I think the bond measure would go a long way.
Thank you very much. Thank you for your support.
I'm Portugal, and I'm here just to say that I talked to a lot of people around town since I became aware of this bond measure, and I think you guys sent out a survey to people, and the results were positive, pretty much, that survey. But what I've discovered is that, I don't know if this is inappropriate, but you know how they say you need to talk to the lowest common denominator. And as I asked around about, do people know, first of all, people don't even know what a bond measure is. Where does the money come from? Who pays it back? How do they pay? All that stuff, people don't know. And I don't know whose job it is to educate the public, but they need to know that stuff. And the second thing is, when the hospital sold to House and Healthcare, I think the last owner of this, almost within a day, they sold the building and the property to this Alabama gang. I don't think there are very many people in this town that even know that. And they may have heard it, but have forgot it. They didn't understand what it meant or something. But I think we need to really educate people. Like Dr. O'Grady said, about the infrastructure. Well, I think we need to educate the public on the advantages of not paying 250 grand a month rent to someplace in Alabama, And I think if the public knew that, the people that are fence sitters would be more inclined to support it. And I'll tell you that I talk to a lot of people around, and I'll do my best to encourage people to be first aware of what's going on, and second, to vote positively when it comes. And your job is to educate the public before this goes to the voter. Thanks.
Thank you, but just as a follow-up to that, after we approve tonight, which I'm assuming we will, there will be a very sophisticated campaign together to do just that. Tell people why we're doing it, why we need this kind of money, what their role is, where does the money come from, how does it get paid back? So hopefully by the time people go to the ballot on March 5th, they will have a full understanding why they should be supporting the budget. But thank you for your comments.
Good evening. My name is Crystal Salcido. I am a District 4 representative for the city of Watsonville. I'm happy to speak with you this evening as a city council member to provide to you my ringing endorsement and support for the hospital bond. I had an opportunity to speak at the 1-year anniversary that the hospital put on, and it was truly remarkable to see all of the community members that have come forward in support of this hospital. When out of 11 hospitals that have closed throughout the state since the pandemic, we're the only one that has been able to remain open, to have a path forward with Senator Laird's measure and support. I cannot wait to see this bond pass, and the campaign that you just mentioned, supporting that, helping that in whatever means possible. I look forward to this formally coming before the council, I think next month, in order for me to give that endorsement as well, and I'm looking forward to it. On a personal note, I had to use the hospital services, not personally, but my father-in-law came to visit. I'm also a new mom. I have a 10-month-old. It was a normal weekend, and unfortunately, he had a very large varicose vein that he has not taken care of, and he almost bled out in our garage. It was an absolute emergency, and we had to take him here where he received outstanding care. What would we have done if this hospital wasn't here to receive him? Drive all the way to Dominican, drive all the way to Salinas. We are so united in not wanting that, and just echo the support that we've heard this evening. I cannot wait to see some of you next month at our meeting, and I look forward to working with you and supporting this campaign. Thank you.
Thank you.
Good evening, everyone. My name is Jasmine Nahara. I served on the healthcare district
Welcome
when I
back.
first started. Thank you so much. I'm here as a community member of Watsonville. I've lived here for the past 17 years with my children and family, and I absolutely support this bond measure. It is crucial that we continue to support this hospital as a community, as it is a community hospital. And it's going to take all of us to continue to uplift and push forward on these efforts. And so, while I know nobody really likes the idea of paying more taxes or paying extra money, this is really a collective effort that we all have to stay committed to. We did not raise over $60 million to see our hospital shut its doors. Personally, I've used this hospital this year for myself and my children and my husband. We've had some serious medical issues, and this is my go-to hospital. I intentionally come here to Watsonville Community Hospital to get my care, and it's always been stellar. And so I just really encourage all of us to get behind this. Thank you so much.
Thank you. Rosalie, are there any other people online who wish to speak to the board?
We do have a few hands raised online. Yes. Do you want to continue taking comments on this topic?
Once
Would you
again,
like to continue taking comments on this topic?
yes,
I will allow a few folks online to speak.
why don't we do that and then we'll go back to the audience, which are.
We have 2 on here. I'll start with Alicia.
Thank you so much. I appreciate the opportunity. I'm Alicia Jimenez. Please excuse the lack of camera. Alicia Jimenez, I'm calling as a member of this wonderful, wonderful community in complete support of the proposed resolution for a bond to protect this hospital and protect the services that this community and our families so much deserve. I think it will bring so much stability to to the healthcare services that our families need every day, and kind of worrying whether or not next year is going to be available or not. It shouldn't be an option anymore. And I think our community is capable of taking on the responsibility of taking care of one another. I appreciate the opportunity to comment. I am away on a conference, but this is very important for my kids who live in this community, for myself, and for all the families that I know are always supported by the services at the Watsonville Community Hospital. Thank you so much for your time.
Thank you, Alicia. Somebody in the audience that would like to speak?
Good evening, everyone. My name is Erica Padilla Chavez, and I am a born and raised Watsonvillian, proud birther at Watsonville Community Hospital when it was a community hospital. What do you know? 48 years later, we're back to being a community hospital. And I'm now a resident of your healthcare district. I live in Royal Oaks, so I'm back home. It's so exciting to be back home. And what an exciting opportunity for us as community members to participate in providing support to our community hospital. So while none of us likes to pay more taxes, the reality is we need quality health care for ourselves, for our families. And I also believe that we went to this length of working as a community to bring our community hospital back to community ownership. What a great opportunity for our community to invest in our community, because that's how I see it. Right? We did a heavy lift. We had a heavy lift to get us to this point, and now it's about depositing that collective effort in a sustainable way for our hospital to be here for years to come. So I'm here as a resident to support the effort. I see this as an opportunity to welcome our community into our community hospital, and I'm here to render support for the resolution and in any way possible to get this bond passed. Thank you.
Thank you. Go back to any online comments?
We do have one online, Andrea Carlos Willie. I will give you permission to speak.
Thank you. My name is Andrea Carlos Willie, and I am a resident of the Corralitos area, but my family has been in the Watsonville area for probably 5 generations. The hospital is the flagship asset in our community that grounds us in well-being and health. And it was thrilling to watch the dynamics play out over the last couple of years as this community saved the most important asset we have around health in our area. And I really encourage you to vote in favor of a resolution for a bond so that we can continue to invest in the hospital and make it a beacon for health more regionally as well. It is an important place that many of us who live and work in the Pajaro Valley area look to for leadership and guidance, and really encourage your affirmative vote on this evening. Thank you so much.
Thank you.
We have another hand up online. John, I'll give you permission to speak.
Hello, my name is John Aird, and I live in Santa Cruz, so I have nothing directly to do with this, but I do have a lot indirectly to do with this. Number one, I am struck by the passion and support from the community. And if you build off that, this is going to pass. I think instead of thinking about this as just imposing, or if people allege this, just imposing more taxes on them, that it's needs to be reframed so that they think about this as assuring the backbone of their community and assuring them with greater safety and security. It changes the dynamic, I think, for some people. The only other thing I would suggest is that I was president and CEO of San Jose Medical Center for over 20 years, so I know something about these issues. And I was also chairman of the California Hospital Association. I applaud your effort. I wish I could vote for it, but I'm out of your district. Thank you.
Thank you, John, for your comments and support. This is John Frill. Nice to hear your voice after so many years. Others online?
I believe those who have their hands up have spoken. So, no.
Anybody else in the audience like to speak on this matter? And no more online?
We do have a new one online, Donna Young.
Okay, let's do
Give
that.
you permission to speak.
Hi, this is Donna Young, CEO for Salud para la Gente. And Dr. McEntee, who is the Chief Medical Officer for Salud, is also dialing in. And we wanted to express our support for the bond measure. We are quite integrated with Watsonville Community Hospital and because we share patients, and it is our job to care for those in the community in an integrated fashion. And a lot of the impact of a bond measure will ensure that we continue to have adequate facilities and that access for our patients in the Pajaro Valley is there's continuity for our patients in terms of access to services across the continuum of inpatient and outpatient care, as well as upstream care, which we collaborate on. And if Dr. McEntee is on the line, she may want to address some of the specifics around that are addressed in the bond that would be in the bond measure. So Dr. McEntee, you raise your hand and then they will unmute you.
All right. Thank you. All right, Dr. McEntee, I'll go ahead and allow you to speak.
Hi, this is Dr. McEntee from Salud para la Gente, and I just wanted to speak on support of the bond measure as well, particularly seeing that some of this might be used to help update radiology and some of the equipment, and particularly if that would be helpful with more timely access for things like mammograms, which has been delayed and a challenge. And we would certainly support the bond measure for helping to improve patient care.
Thank you.
And that is all online.
Okay, anybody else in the audience? Nobody else online? We'll close the public.
One more.
Thank you. Go ahead.
Hi. My name is Penny Smiley, and I was born and raised here. I have worked at Watsonville Hospital for over 36 years. And I'm here to share with you why I support the measure for this community. When I was in my early 20s, my mother had a heart attack, and she refused for us to call 911. So my dad and I drove her to the hospital. It was that 5-minute drive was the longest drive of my life. I can't imagine what it would be like to not have a local hospital nearby. So I know that this community is full of stories like mine from the past, future, and that is why I'm here supporting this bond measure and why I feel very strongly about this. I'll be honest, typically I would say I would never vote for a bond, but for this one I feel very passionate. And I do feel like it needs to pass. So thank you for your consideration.
Thank you. Anybody else online? Nobody else in the audience? I'll close the public comment period and we'll move on to the agenda. Comments from the board members? Okay, so we'll go to the consent calendar. Yeah, I was just gonna say, leave a public comment on the agenda, which is the minutes and public summary approval. Comments from the audience? Okay. Need a motion to pass the consent calendar?
I'll second.
Full board?
Yes, Director Diggins.
Aye.
Director Cox?
Yes.
Director Pennantile?
Yep.
Director Gallagher?
There's no one in the room with me under 18 or over 18, so Gallagher, yes.
And Chair Creel?
Yes. Okay, moving on to discussion. Next executive committee report for November 2023. We received that earlier from Dr. Angel. We take all these at once and vote on them at one time. Yep. The Watsonville Community Hospital Quality Report for November 2023. Tracy, yes.
Sure. Can you bring up?
What?
Yeah, the motion to approve. I'll
Oh,
move.
I thought we were gonna take them all at the same time, that's what I asked.
No, these are individual items.
So we need a motion to approve.
Casey's gonna present, I'll present it, yeah, so we're doing one at a time.
Motion, medical executive committee report.
We have item 3, medical executive report. I think you're reporting on item 4. Yes, so I'll move approval of item 3 that was included in our board packet as received and read by all of our board members and discussed in closed session.
I'll second.
Move to pass.
Director Cox, you're on second? Yep. Yes, Director Nunez?
Aye.
Director Cox? Yes. Director Pennantile?
Yes.
Director Gallagher?
Yes.
Chair Creel?
Yes. Okay, the second item, then the next, number 4 on the agenda is Watsonville Community Hospital Quality Report for November 2023. Tracy.
I just have a presentation you can share, that's fine. Thank you for having me. We had no regulatory activity during the past 2 months, actually. And we did have a visit from our Kaiser partners to visit our surgical services earlier this week, and that went very well. There were no significant findings. They looked at our surgical service lines from a perspective of risk and infection prevention. We do have some announcements. Staffing in our department, we've added a new risk manager, Kaylee Young, started October 3rd, and a new infection preventionist started on November 15th. Moving into the data portion, we have all-cause readmissions. This is our HSAG data, which captures our CMS patients only, and the current available data is up through May, and we did see a bit of an uptick in May, so we will continue to monitor that. We had been trending down prior to that. On our all-cause mortality data, we have been, April and May were performing, April was under target, and May and June slightly above the target, so we will also track and trend that as well. Very excited to share the data on the following slide. Our hospital-acquired infections for catheter-associated urinary tract infections and central line-associated bloodstream infections. We've had no infections in either of those areas since February of 2022. So excellent care provided. Following, we discuss our fall rate. We have an active fall prevention program, and our rate has continued to decline over the year. And we are have not had a fall with injury in over 18 months. Next slide, please. I wanted to share our leapfrog safety grade. In the spring, we had a D, which we were not very pleased about. Of course, that's not the type of image we want to project or the care we want to provide. We've been diligently working on some of those measures, and we are proud to say that we have risen to a C, and that's average. That's not good enough. We'll keep trying, but we do have a plan in place to keep moving the bar on that particular measure. Next slide, please. Just a highlight of where we are. Some of the things that we did extremely well on this last quarter. The shout out to our physician and health informatics folks. The computerized physician order entry rose significantly, so we're doing an excellent job there. Also, nursing care hours and hand hygiene programs were very, very successful. There is a little bit of red, and we will look at that on the next page. What you're seeing down there at the bottom for red is our falls and trauma, and that is a fall with hip fracture. That if you will look closely here, leapfrog determines the grading period for, and they're not all aligned for various measures. And we're looking at data here from July of 2020 through June 30th of 2022. So quite old data, if you will. So it will take us a while to for that to fall off of our record. Next slide, please. One particular area we've struggled with of late is C. difficile, hospital-acquired infections. We've had a very robust and active committee that's taken a lot of positive measures, nursing education policy updates, physician education, and practice changes. And we are seeing some improvements in that particular area, and we'll continue to work on that as a focus for next year. Next slide. Just some highlights, the things that we are doing well. We mentioned computerized physician order entry, the cultures of safety, how we operate in the hospital, and the willingness to speak up. We also have significantly very good results in RFOs and air emboli. We're not seeing those type of complications in our patients, which is reflective of a very high quality level of care. The opportunity areas we'll be focusing on in the coming year are our physician staffing in the ICU, the practice and culture measurement, our HCAHPS, which is the patient satisfaction measures, CDIP, as we mentioned, and the PSI 90 is a measure of complications that we followed. If you'd like to know more, there's some resources on the next page about Leapfrog and how that particular scoring system and rationale works. And are there any questions about the brief overview shared?
No question. I really appreciate having the presentation. I know that's hard work to get that done for board packets. So I haven't done that in my professional life. I appreciate the effort and it's really helpful. Thank you for that.
Okay, so we need a motion to approve the quality assurance report for November.
We do not have a motion on the table for this item.
No motion.
Please go to public comments.
Receive and file.
Any public comment on this? Comment?
Do not have any hands online.
Okay, anybody in the audience like to report on the comment on the report that was just made? Okay, now we're open for motion.
We don't have a motion on the table.
So I'm asking for somebody to make a motion on the table to approve this.
We don't need to.
It's not required. We don't need to.
Just receive and file.
Okay.
Sorry,
Okay, fine. We'll go on to number 6, which is, no, I'm sorry, we'll go on to number 5, which is executive office report, Stephen.
Chair Creel and board, thank you for the opportunity to speak to everybody on my my first board meeting. As I said, today is the 4-week anniversary of my start, so I appreciate the opportunity to work with this amazing team and the amazing team that's out here and everybody that I've gotten to meet. So I'm going to tell you a little bit about what I've been up to for these first few weeks and some updates on what's going on at the hospital. The first item on our strategic plan and strategic priorities is community health and community advocacy. So one of the first things that my team has enabled me to do is to go out into the community and reconnect the hospital with the community. So I've had a number of opportunities to do that, presenting to leadership Santa Cruz, doing a number of interviews with local press. I was able to participate with some members of this audience on a panel with the United Way to talk about the real cost of living in our community from a healthcare perspective. I've been able to meet with a number of elected officials, both in Watsonville and the county, as well as Speaker Rivas. And I've continued my roles on the Santa Cruz County Human Services Commission and the Executive Committee of the Board of the Health Improvement Partnership of Santa Cruz County, which are roles that the Watsonville Community Hospital hasn't been represented on for quite a while. And so it's exciting to be able to bring that into perspective to those groups that I've been a part of in my 11 years living here. From a provider recruitment standpoint, we're continuing to work towards recruiting additional intensivists for our ICU and for our critical care patients. Myself and my colleagues have had a number of meetings with additional physicians and surgeons in the community about their work here. Some who are interested in coming here because they're hearing about some of the good things that are happening here. And hopefully we'll have more news on more physicians coming to bring their patients and their services to our hospital in the near future. And we met recently with our lead cardiologist to talk about the cath lab and the opening of the cath lab, which I'll talk about in a second as well. What I'll talk about now, the cath lab equipment arrived earlier this month and the installation process is happening, and the construction around the new equipment will occur over the next few weeks. And we hope that by some point in early 2024, we'll see our first patients with our cath lab. So more to come on that in the future. We'll continue to keep you updated on that, but things are moving along well there. We had a good meeting with one of our cardiology providers on that just earlier this week. People and culture. So it's really clear that the culture of this hospital is a strong one. The rounding, I rounded on day one, and I've been rounding ever since. And I just hear from people who have worked here, oh, I've been here 25 years, I've been here 30 years, I've been here 35 years. And I always ask them, what keeps you here? And they tell me that it's the people around them, and it's their patients and the community that they get to serve, and the community that they grew up in, and that they get to continue to help and provide for. They get to see their neighbors when they come in some of their worst moments and get to help take care of them. And it's just such an honor to be able to help support all those people who are doing that work and be a part of that. And so I really enjoyed getting to know everybody. When I had one of my first conversations when I got here, somebody asked me what I was planning on doing. I said, well, I have about 650 names to learn. And so I'm a data nerd. I've actually been counting. So I'm at 10%. I've learned 10% of the names, and I'm going to keep going. I'm going to see if I can accelerate that. But I come back to I learn the names, I come back to my office and I write down, I see on the list, okay, I met that person, I met that person. It went up, that 10% was from yesterday, I rounded a bunch today, so it's higher than that. But I'm gonna keep counting that until I learn all 650 names. We also got a chance to serve Thanksgiving dinner or Thanksgiving lunch and dinner to our staff and our providers and our volunteers. Dr. Gallagher, thank you for joining us for that really fun event. That was a warm welcome that I got to help do that. So that's my general update. The rest of my update, I'll give a financial update. Julie doesn't have a financial update today. We don't have a financial presentation for the month of October, so we're still working on closing October. The reasons for that is we're posting some late client entries from the audit. So the audit was approved last month. And that gave us some new looks at the financials. And so the accounting team is continuing to review how those entries are posted and how they're displayed in order to finalize the operational performance for October. So we anticipate having that soon. And we'll continue to close, and we'll close November as soon as that is closed as well. The other work that's going on the finance side is the 2024 budget. So the finance team continues to drill into the details to look for efficiency opportunities, look at the cost side and the revenue side for our budgets and making budgets for each individual department director. And so our directors and managers have provided their insights into the needs and the savings opportunities that they have for the 2024 budget. At this point, we'll probably be looking at a stretch goal, which will be to break even on EBITDA for the hospital, with a corresponding loss at the consolidated level with the clinic and the MPT lease that has been mentioned here before, gives us that operating loss, which again, when we bring the budget in its final version in December, we'll have more specifics on what that exactly looks like. For 2023 so far, November cash collections are up about $30,000 per banking day over October, so we're happy about that. We've had some good revenue cycle improvements. I met with the revenue cycle director today, and she was telling me about some of those. We did receive the Distressed Hospital Loan Program funds on November 1st, and that money has really been being used to catch up on our accounts payable and to pay back some of the loans that we got during the transition process. We were able to execute a $2 million line of credit with Santa Cruz County Bank and our two original guarantors, Salud Para la Gente and the County of Santa Cruz. So thank you to those partners for that. And thank you to the City of Watsonville for approving an additional $1 million that we will add to that line of credit in the near future. Respectfully submit my CEO report, and I'll take any questions if anybody has any.
Thank you, Stephen. Any questions?
Questions, just gratitude. Continue gratitude.
Right back at you.
Feeling really overwhelmed today. But,
There's a lot, there's a lot of work. There's a lot of work.
Yeah. Thank you.
So we need a motion to approve the CEO report.
Sorry, we actually do not need a motion for that.
Okay. So move on then to item number 6, which is the co-tenancy agreement between the Power Valley Healthcare District and the Power Valley Healthcare District Corporation. Ethan, you want to talk to us about that?
I'm going to let Matt go take the lead on that one. Okay, thank you.
Thank you, Chair Creel, Stephen. So the co-tenancy agreement is a document that we're putting in place to create some structure between the hospital corp and the district for management of the property and assets that we're leasing from MPT as part of the asset purchasing agreement. So there's no financial impact. Everything's already structured and happening. It's just allowing for structure as we go forward and either renew leases or look for new lease partners. Is there any questions specific? So just asking you'll see this on the other agenda as well, just asking for resolution to pass this. So we will need a motion, please.
Okay, no questions for Macro? Any motion?
No questions. Again, gratitude. The staff report was really well done. The attachments were lengthy, but also interesting to read from my perspective. And it's really nice practice that we're doing. We talked about this, and I appreciate this happening. So it's just incredible that practice we're bringing on board in year 1. So thank you for the work.
Is that a motion?
Sure, I'll move approval. I'll second that.
All right, Director Nunez?
Aye.
Director Fox? Yes. Director Pimento?
Yes.
Director Gallagher?
Yes.
Chair Creel?
Yes. Okay, with that, we adjourn from this particular meeting.